Good afternoon. How are you today? Fist pump. It's good enough. Yeah. So what seems to be the problem? Ooh. Yeah. Mm-hmm. Okay. Well, I think we can at least take a look at it. You want me to take a look at it? I know it's an emergency condition, but I don't mind. I'm here. Mm-hmm. It's not my specialty, but well, I've had to do a little bit of emergency dental work in my day, believe me. The eyes aren't what they used to be, though. That's a problem. So I might have to resort to wearing my specs. I hate to do it, but does it hurt that bad? I'll tell you what, I have my otoscope handy. Maybe I could just zoom in on it. Oh yeah. Oh yeah, I can see what you're saying now. Does it hurt right there? Let me my mirror so I can look back behind it. At the same time. Oh yeah. Yeah. Let me can you hold still just a second? Let me just kind of poke it with this tool here. Oh yeah. 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 That's definitely a problem area. Do you have any pain down the side of your head? Down this side? Or down the neck right here? Just in that area? Okay. Alright. Let me take one more look. I know it's painful, but before I, administer any kind of drugs to help, I want to check everything as close as possible with the tools. So, sure. And I know you want the best care available. Mm-hmm. Sure. I'm really worried about you. Your care is number one with me. So let's take another look, okay? Oh yeah. Oh yeah. I think we need to administer some shots. What do you think? Do you think so? Okay. I've got some Novocaine right here. So let's get that in there. Some on the right, left. This will be the left side. And then another shot on, well, we gotta get a shot on this side. Okay. And then we'll put a shot down here in the bottom jaw. Right about there. Yeah, right in there. Ooh. Yeah, that feels better already, doesn't it? And then we'll put a shot in right here. Okay. Very good. Well, I loaded you up with so much Novocaine, I don't think you're going to feel a thing. What do you think? Okay, we're going to let that take hold, and while we're doing that, I'm going to do a little cleaning. We're just going to, before we do the emergency work, we're just going to do a little bit of cleaning. Yeah. Get some plaque off there. Right in there. There we go. And then if you just hold still, we'll just do. Yeah. Oh yeah, that's good. You getting a little sleepy from all that? Well, when you have that much pain, it can affect you like that. Probably haven't slept well in days. Yeah. So I'm all too happy to bring you some pain relief. Yeah. Okay. Now, I'd like to clean the bottom row of your teeth a little bit, where the damaged tooth is. Just right there along the bottom. Like right there. Can I do that? Alright, good. Right there? Yeah. Okay. Good. Good. You're doing excellent. Yeah, you're doing so good. I'm really happy with the results. I know it's frustrating, but we want to, keep an eye on the prize, and the prize is we want to make sure that you are completely in a pain-free environment, and that we get to the bottom of this problem. Yeah. I think I could just yank that tooth right out, to tell you the truth. But we're going to do a little more cleaning. We're going to make sure there's no obstructions around it or anything that might cause a problem later. Okay. You hold still. I'm going to make a few probing taps with this. Now, this isn't going to hurt. It's sharp, but it's not going to penetrate. Now, what we want to do with this is we want to see if you can feel any pain. So can you feel that right there? Okay, and then right up in there. Do you feel that? Yeah, right there. Now, if you feel any pain, you have to let me know right away. All right? There. Okay. We're just checking. Make sure the Novocaine's taking full effect. And you're very sensitive around here. Now, what I want to do here, right around that tooth, we want to make sure we get in everywhere around there. Do you feel anything? Oh, you do? Maybe we should get a little topical. Where did I put that at? Here's somewhere here. Just some topical. And we're going to cotton swab that, I tore my glove. My glove totally fell apart on me. I'm going to have to get another one. So let me get one out of my box. I have a whole box of them. No, it's okay. It takes as long as it takes, right? Okay. Now, where did I put my cotton swab? I'll just do another one. Okay. I'll just get that down in there. Squeeze that down in there. Pack that down in there. There we go. That should take effect. Now what I'm going to do is we're going to make a very small incision on both sides of the gum so that tooth will just come right out. Okay? So don't you worry. We're going to let that take effect. I want to look real quick while we've got you waiting. Yeah. Yeah. Looking good. Looking real good. Looking real good in there. Oh no, don't worry. Everything looks great. Everything looks fantastic. You are an excellent patient, really. You're so calm. We're going to check real quick here. It should have taken effect. Once again, this won't hurt. Let me just do that again. I want to make sure we're 100%. You feel that? Okay. No? Right there a little bit? Okay. Maybe we should go ahead and give you one more shot. Ooh, I'm going to get it in the back this time. Yeah, there you go. How'd that feel? You like that? Don't worry, it won't hurt. You won't feel a thing here. Just a minute. Okay. Now, I'm going to use this little spatula. I just want to lift up your tongue. I want to look in the back of your throat. Oh, yeah. Got good coloration, at least. Good color. That's good. Let's let that take effect again. I want to show you what we're going to do. I have these. Wonderful. They're kind of hard to see. So I'm just going to hold it up here with it's a cap. We're going to pull the tooth and see that? Look at that. Now that's a fang. It's got a safety tip on it. That's a little safety plastic tip. Look at that fang. Now that's a fang. Okay, now that fang right there is going to go, once we pull the fang out, believe me, I've worked on many paranormal creatures before, werewolves, Bigfoots. I once pulled a lady out of a giant prehistoric reptile or dinosaur, I don't know which, right out of its throat. She got stuck in its throat. But I've never done this. It's the exact thing. But what we're going to do is we're going to put the screw-in cap up in, and then this is just going to pop right on top. And then we'll just scrape that safety cap off, and your fangs will be back to 100% normal. Gotta keep that handy. Okay, how's that sound? Okay. Well, yeah, I have to be honest. I don't have a personal grudge against vampires. I used to go to Walmart at like midnight, and I'd see the goth kids coming in, all dressed in black, the lipstick, the clothes, the hair, and I would, kind of walk up to them, and I look like, I don't look like I'm there for my looks, at 12, 1 o'clock at night, and I'd say, hey, you guys gotta be careful, there's a lot of vampires out tonight. And they'd all, look at me like I was silly. And then the next week they would all be in the same Walmart. And you could tell they were all victims and turned into vampires. And I'm like, they would walk up and go, like, we didn't know. It's cool, bro. It's cool, bro. Fist pump. And I'd be like, get away from me. Goth vampires. It's like being a vampire is okay. Being goth is okay. But combining the two, it's just too much. Do you agree with that? It's like a culture clash. Is that what it is? It's like they're trying too hard. Is that what it is? Yeah. It's like, how you had Nirvana, and then you had like other groups trying to emulate them. That's it. It's like, okay, the Beatles were cool, but the Monkees were for the kids. That's a good analogy. That you're older, you get that analogy, yeah. But Neil Diamond did write a lot of songs for the Monkees, so that was cool. Yeah, Michael Nesmith, I never understood that. Make the money, but he just couldn't keep it together. He wanted to do his own music. That's the whole goth mentality. Like, hey guys, now that we're vampires, we're going to reinvent this whole thing. We're going to reinvent the wheel. It's like, no, you're going to get your heads ripped off and garlic stuffed down your throat, because you're freaking goths. Already nobody wants you around. It's like, hello, now you're a vampire. You're going to get your ass killed. But they don't listen. They're kids, they're kids. Like, how old are you, like, honestly? Yeah, see, so like, at 165, you've been around, you know what I mean? I'm sure you've seen a lot. Okay, so you get it. I know. You can't tell these kids anything these days. I don't like to just diss the millennials, because I'm not a fan of the baby boomers, believe me. I'm Gen X. I am. Really? Oh, really? I didn't know you had a lot of Gen X friends. Oh, that's so cool. Thank you. I really appreciate that. Well, here, I'm going to reach in real quick with this. It's so nice to meet you. It really is. I don't get to meet, werewolves are a little, like dogs on steroids type thing, Vampires are more like, I don't know, like college professors that look like Brad Pitt. I don't know how to describe, they're like movie stars or something. That's probably why they picked Brad Pitt, I always thought about that, like if Brad Pitt came up and wanted to bite me as a vampire, turn me into a vampire, would I be like, come on, Brad Pitt, like, I know you're handsome, but it's like, it's too much, like, you're that good looking, you were married to Jennifer Aniston and Maleficent, and you're a vampire, you get to live forever. It's like, no way, keep it, it's like Fight Club, keep it to yourself, Brad Pitt. What stays in Fight Club, what happens in Fight Club stays in Fight Club. Don't talk about it. It's like, I know. And then he's like with Thelma and Louise. It's like you got to sleep with like Susan Sarandon and what's her name, that other lady that nobody talked, Gina Davis, and even Jeff Goldblum couldn't hold on to Gina Davis, but you're Brad Pitt, so like you did Thelma and Louise, Maleficent, Jennifer Aniston, and then you want us to feel like sorry for you because you need like to suck our blood because you're a vampire. It's like bullshit. I'm calling bullshit, Brad Pitt. Not today, not my neck, like, go to the blood bank. There's some stray cats out in the alley, give them a bite. Leave me out of it. I'm glad you agree with me. I really do, because it's bad for it's bad for the vampires. It is. You can't have Brad Pitt and who's that other guy running around? Tom Cruise, getting all these, everybody wanting to be a vampire. Next thing you know, there won't be enough people to go around. And then we're going to have to go back to hunting vampires again and, killing the werewolves. And that starts the whole thing, That Twilight thing I didn't like it either. Wait, let me do this real quick. And we're going to do the whole Twilight thing. Okay, can you feel that? Okay, can you feel that? Right there? Oh, I'm really pushing. Nothing? I think you're ready. Okay. Now this thing's probably just going to pop right out. So I don't want you to get upset. And I've got a beautiful pair of clean, and they're not silver, forceps. They're surgical steels. They won't hurt you. I'm just going to clamp on that old Fang and rip that sucker right out, okay? Then we're going to drop it in the old bucket, So, don't worry. Yeah, Twilight, he was a senior for like 80 years, and he's like 120-year-old senior in high school dating 17-year-old girls. Like, come on. And he can't even, get like an A in chemistry. Like, come on. Get with it. Like, it's Hollywood. They ruin everything. They really do. Okay. All right, let's get that tooth out. I'm going to pull that thing right out. Oh, it popped right out. Ooh, that looks bad. Let's just put that over here in this bucket. Here, if I can put it in here. There we go. And we're going to have to stove off that bleeding a little bit with this cotton. I'll just hold it in your mouth for a minute. Okay. Push that up in there. You're doing great. Okay, not much bleeding. Well, what did I expect? You're undead. Okay, now we're gonna get this tool out, and this is pretty easy actually. And we're gonna screw in this cap. So just let me screw in that cap up into your gum. Feeling any of this? Okay, good. Good. No, you're great. You're doing great. All right. Nice, tight flush. Well, we can do this pretty quick because, there's no healing per se. Not like a normal person, And then let me just check that for tightness and get my forceps on that and make sure it's up in there good. Okay. Feel that? Pulling on it pretty good. Good tug? Okay, good. I think we're ready. Yeah. Let's go ahead and get that cap. Where did I put that cap at? Put a little bit of... I want to clean that screw now that it's... The screw, I want to make sure it's sterile up inside your gum. Just take a second. You're very patient. Oh, what the hell, you live forever, It's no big deal. What's a dentist visit once in a while? How'd you break your tooth, by the way? Get some cotton up in there. Get that all sanitized up in there. Good. All right. I feel pretty good about it, but I just want to, just making sure all the tissue around looks pretty good. Okay. Now, here's the cap, the tooth, Fang we're going to put in right there. And I'm going to get that up in there. It just pops right in. Just like that. You hear it pop? then we just got to scrape that safety tip off. And the way we do that is with this little tiny file, wherever I put that thing. Okay. Just gotta scrape that off. I'll just use these forceps to pull that off a little bit there. There, good. And then we just want to clean that up a little bit. Make sure we get it nice and clean. And then just wipe that down a little bit. There. Pull that wadding out of your mouth. Okay, can you move your jaw up and down for me just to make sure? Good. And, well, I realized I didn't have to cut the gum. It was, that tooth was ready to go. But I think that has to do more with your vampire physiology than anything else. Okay, can you clench your teeth? Okay, now I'm going to give you a piece of paper. And I want you to bite down on it for me. Just going to stick this right in there like that. Bite down. Okay, bite down. Okay, I have that impression. Yeah. Does it feel good? Feels like the right shape? Everything's good? Oh shoot, I shouldn't have done that. I gotta wash my hands. Sorry. It's this COVID thing is driving me nuts, I know. I'm sorry, I should never touch my face. Hope you forgive me for that. Okay. How's it feel? Good, good. Really happy for you. I have had to do some pretty crazy stuff with werewolves, and I have treated some vampires, but more or less for minor things, not for dental work like this. I don't think I've ever had to do that before. So just let me take one more peek. Okay. Good. Alright, good. Let me look inside there a little bit. Good. How do you feel? Good. I know I keep saying good to a creature of undead and purest of evil, but I know we all have our place in the ecosystem. My name, after all, is Dr. Andrew Michaels, and I always claim that I'm here to help you. So I could do no less than help you, even if you are a supernatural creature. I know you have a treaty with my people, and you haven't preyed on normal human beings, quote-unquote normal human beings, in quite some time. So I understand. No, it's quite understandable. I think the big thing here is that, if you don't mind, I'm going to take this off and you can sit up and, here, some water. You can rinse your mouth out. It's clean water. Just rinse your mouth out, it won't hurt you. There you go. Spit it in the bowl. Oh, you were great. And I know it was like a last minute thing, weekend surgery, and I know you feel bad making me come in at this odd hour, but I understand. You can't be out during the day, so we have to take care of things like this sometimes that don't always happen 9 to 5, so I'm totally okay with just helping you out. Do you feel good? Good. I know it's, do you feel good? Well, do you feel normal? Do you feel like yourself? I feel good. Yeah, I'm going to church tomorrow. I know, it's funny. Well, we try to keep, things, it's a government office, so we try to keep all religious items and observances out of the building. So everybody thinks it's that, separation of church and state, but they don't realize that the vampire culture was integral to the Revolutionary War and the success of the early 13 colonies. So, separation of church and state was a must to keep the treaty between us. It's funny the governments of Europe just were so backwards when it came to your people. Just think all those cultures, and ours was the first one to recognize and give you the equal freedom. All men are created equal. Well, what's the difference between, a human man or a werewolf or a Frankenstein's monster or a vampire? Oh, with the zombies, no. Just, I'd appreciate if you didn't tell anybody I was a zombie racist, but there's some bad blood there. I've lost a few people to them, and I've seen how they operate. Yeah, it's not, no. I'm glad we agree on that. There's just some things, there's just some lines you can't cross. I mean, some of my best friends are witches, demonologists, vampires, atheists, Methodists. I mean, I've seen it all. Yeah, but I can't abide by a zombie. No, that's why we live in a gated community. I was just talking to my friends down the street, and and we were just like, it's not gonna happen, not in my lifetime. No. Well, it was really nice meeting you. Yes, likewise. Oh, I think you'll love Chicago this time of year. What's that ball called? Yeah, the Bean. Yeah, you're going to go down and see it? Yeah, you want to see that with a moonless night because it really, really reflects the sun and the moonlight, sunlight really reflects on it. Yeah, you want to see it like when there's a new moon and not a lot of light in the sky. Okay, well, you have a wonderful day. I'm so glad I got to help you with this emergency surgery. Okay. Well, until I see you again, please have the best day you can. I hope you have a good night. Okay, yeah. Right back at you. All right. Okay, he was nice. Emergency dental work on a vampire. Who would have thought? Just another day at the office for Dr. Andrew Michaels. Who am I talking to? I'm going nuts.